woman opens a paper medical bill at her kitchen table and stares at the final balance in complete shock. Her 15-minute video call on her laptop with a doctor cost $800. The doctor spoke to her about a simple skin rash while she sat on her own living room couch. But $500 of that total bill was listed as a facility fee for a hospital room she never entered. She sat in her own quiet living room. She used her own home internet connection. She drank tap water from her own kitchen glass. Yet the paper statement claims she used a physical medical space in a hospital 10 miles away. She did not drive her car. She did not park in a garage. She did not sit in a waiting room or touch a clean sheet on an exam table. This extra charge happens because of a clever financial trick called provider-based billing. Provider-based billing is when a hospital splits a single doctor visit into two separate charges. The first charge is a professional fee for the doctor's personal time and advice. The second charge is a facility fee for the use of the physical building. It turns one simple appointment into two distinct and expensive bills. When you walk into a real emergency room, a facility fee helps pay for electric lights, clean sheets, and a team of nurses. That extra cost makes sense when you are actually inside a physical medical building. But when you are sitting on your own sofa using a computer web camera, there are no hospital lights, no clean sheets, and no nurses standing in the room with you. Inside the hospital accounting office, the reality is very different. Computer billing systems process thousands of patient files every single day. A worker changes a simple code on a screen to reclassify a small doctor office as an official extension of the main hospital building. Suddenly, every single patient interaction connected to that clinic gets a higher price tag automatically attached to the digital record. This back-end process is called outpatient clinic reclassification. By shifting a label on a hospital computer server, a large health system turns an ordinary doctor office into a hospital facility. This trick allows them to charge extra fees for online video visits. They treat a routine Zoom call as if the patient was lying in a specialized medical bed, surrounded by expensive hospital equipment. This widespread practice works very much like upcoding. Upcoding is when a medical billing department charges for more work or a higher level of care than what was actually given to the patient. Adding a physical building fee to a virtual video chat inflates the final bill far beyond the real cost of the medical care that was delivered through the computer screen. The main drive behind this practice comes down to corporate profit. Big health systems buy up small private doctor practices every month. Once they take ownership of the clinic, they turn on provider-based billing for every patient. A simple video checkup that used to cost $100 suddenly brings in $500 in total revenue, all without adding any real medical value for the patient. Deep inside insurance company headquarters, claims fly through automated computer networks. These automated systems act as denial bots, checking codes and approving charges without a human worker ever looking at the details. The denial bots see the hospital facility code attached to the video call claim and approve the extra charge automatically, passing the inflated cost straight through the national healthcare system. Insurance companies often pay these extra charges without putting up a fight because they pass the cost directly back to you. The higher charges show up later as bigger monthly plan payments or higher out-of-pocket bills. When a patient has a high deductible health plan, they must pay every dollar of that fake facility fee out of their own bank account before insurance covers anything. For an average family, receiving a surprise $500 bill for a 15-minute video call is a crushing financial blow. It ruins carefully planned household budgets and forces parents to make hard choices. They must decide between buying basic groceries, paying electric bills, or paying off a bogus medical charge for a hospital room that they never stepped foot inside. In the year 2020, millions of families switched to telehealth because it was promoted as a safer and cheaper way to see a doctor. People believed that talking to a healthcare provider on a screen would save them money on gas, parking, and lost work time. Instead, predatory billing habits turned virtual care into a quiet cash machine for large healthcare corporations. This entire financial trap exists because of an old government regulation written decades ago. Lawmakers originally created the rules to help real hospitals recover the heavy expenses of keeping huge physical facilities open around the clock. The policy was designed to support full-service emergency rooms, trauma units, and advanced operating rooms that must stay open day and night for community emergencies. However, profit-driven health networks found a major loophole in those old rules. They applied those old facility billing rules to brand new digital technology that requires zero physical space. By using this legal gap, health systems claim that maintaining server networks and digital medical records justifies charging the exact same facility fees as a real, physical emergency room building. The extra cash gathered from these virtual facility fees rarely goes to nurses or frontline healthcare workers. Instead, it feeds administrative bloat across the entire medical industry. Administrative bloat means spending vast sums of money on top executive salaries, billing managers, legal teams, and aggressive debt collectors, rather than spending that money on actual medical treatment or better care for sick patients. Back at her kitchen table, the patient holds her explanation of benefits paper, commonly known as an EOB. An EOB is a document sent by the insurance company that breaks down what was billed, what was paid, and what the patient owes. She circles the extra facility fee in bright red ink and picks up her telephone to demand a clear explanation. When she calls the customer service phone number listed on the back of her card, the phone representative uses complicated industry phrases to push back. The representative explains that because the doctor is employed by a hospital network, the facility fee is standard protocol. The agent uses prepared script answers designed to confuse the caller and make her give up the fight. The patient asks one simple question to the representative on the line. What physical room did I occupy during my 10-minute video chat? The representative goes completely silent because there is no logical answer to give. Yet the automated billing computer is set up to keep sending final notices until the patient breaks down and pays the whole amount. If the patient refuses to pay the fake facility fee, the hospital quickly transfers the unpaid bill to an aggressive debt collection company. The debt collectors place negative marks on the patient's personal credit file, lowering their FICO credit score. A single video call conducted from a living room couch can end up damaging a family's credit score and blocking them from buying a house. Looking at the national scale, This billing trick creates a massive financial burden across the entire economy. Millions of virtual medical appointments take place across the country every month. When thousands of hospitals add hundreds of dollars in fake facility fees to each video call, it adds billions of dollars of artificial costs to the total American healthcare bill every single year. There is a massive disconnect between what virtual care actually costs to provide and what hospitals charge for it. A real clinic visit requires physical office space, paper supplies, electric power, and clean medical tools. A virtual appointment requires only a laptop and a clear internet connection, making the high price of virtual care an artificial creation of hospital billing departments. This huge price gap proves that medical billing has shifted far away from actual patient care. The primary goal of the system is no longer just helping sick people. It is finding hidden legal loopholes to extract as much cash as possible from every single patient interaction, whether that interaction happens in a physical exam room or across a digital computer screen. Some informed patients are starting to fight back against these unexpected facility charges. When a surprise fee appears on their medical statement, they immediately demand an itemized bill with all specific medical codes included. They look closely for facility billing codes and formally challenge any charge that claims a physical building was used during a virtual phone or video call. When patients demand written proof of physical resource use, hospital billing departments sometimes back down and drop the extra fee. They remove the charge because they know they cannot prove a physical room was used during the call. However, millions of patients do not know their legal rights, so hospitals continue to collect millions of dollars in unearned cash every day. The rapid growth of digital medicine was promised as a great leap forward that would make medical care cheap and simple for every family. But without strict limits on facility fees, predatory billing practices turn modern technology into a new corporate profit machine. A tool designed to help patients has become another way to drain household savings accounts. Until lawmakers close this expensive regulatory loophole, every patient using telehealth must examine their medical statements with great care. Every time you log on to a video visit with a doctor, you must verify every charge on your bill. Understanding how hospital billing tricks work is your strongest defense against paying high fees for a hospital room you never stepped inside.